Hello! In this video clip I explain how you can strengthen reflection on care by involving an expert by experience in a team. In this experiential learning method, a patient, as an expert by experience, is involved in a group of caregivers. This learning method brings caregivers closer to the experience of the care receivers and helps them to understand better, broader, the suffering, the vulnerability, and the needs of the care receivers. The caregivers can better adjust their caregiving to the care receiver's needs, as well as reflect on their own feelings and their needs as a caregiver. The patient helps the caregiver to reflect on the care provided and stimulate them to do even better and more thoughtful. So, there's a better understanding between each other. It's good to focus on a problem, for example, a caregiving perceived as difficult, indicated by the caregivers. For example, in a day hospital, a team cares for two groups of patients, oncology patients and patients with chronic fatigue syndrome and fibromyalgia. The team experiences aversion caring for patients with chronic fatigue syndrome and fibromyalgia because of the discrepancy between their symptoms and their behavior. For example, they report high pain scores while having fun with the roommates. The team wants to understand the patient group better, to approach them professionally with understanding and empathy. They also want to deal in a different way with their own feelings as caregivers. So if you want to start, you have to find an expert by experience willing to engage in dialogue with the team, which isn't an easy task, because the patient makes himself vulnerable to the caregivers. It can be a patient known from the team, but sometimes it is better to find someone independent, for example, a patient from a self-help group. To bring caregivers closer to patients, you can organize a meeting or an information evening. It's important to prepare both the expert by experience and the caregivers for the encounter. You need to guide the care receiver in the story he or she wishes to bring. The caregivers get the opportunity to ask questions in advance, online, anonymously. Those questions the expert by experience can prepare and integrate the answers into his story. For example, they ask, how do you experience your illness? Can you easily balance work, illness, daily activities? What do you know about different therapies? On the encounter, the expert by experience explains the disease, its symptoms, and the long road before they are diagnosed. The doctor explained the treatment process of the patient group chronic fatigue syndrome fibromyalgia, and the caregivers asked all kinds of questions. The caregivers discussed with the patient and the doctor about the difficulties they experience in providing care, and together they looked for alternatives. At the end, we asked to reflect on the encounter. What did you learn? Do experiences make you look differently? At care receiver, at the department, at the organization? What do you know, what you did not know yet? What do you take with you? Has this experience changed you? The reactions were very positive. For example, they said, it makes you think about what the care receiver is going through and experiencing. As a nurse, I look more from the other perspective, the perspective of the care receiver. You can ask questions directly to the care receiver and they can give advice on how to deal with certain issues. The care receiver indicates what the caregiver can give as good care, that there are limits, what's helpful is. You notice that there are different types of patients and you can't lump them all together. You find out the opinions and views of both the care receiver and the caregiver. So, what's the conclusion? The caregivers try to listen to people's personal stories and try to understand the other person's perspective. By getting to know patients better, we help caregivers see patients as human, as person, rather than as difficult patients. We also reflect on their antipathy, what they feel. It's just a feeling, and on the choice they always have as caregivers in terms of the care they want and can provide. In this method, the power is in talking about these feelings with the patient and in a team to achieve better care, both for the caregiver and the care receiver. We've come to the end of this video. Thank you all for watching and wishing you good luck with the tryout. This tool and video clip were created by Vives, one of the Belgian partners of the ETHCOM project.